I would like to call the Community Development Committee meeting to order. And Madam Clerk, if you could note that I am here along with Mr. Brennan and Mr. Bailey.
Yes, ma'am. Thank you.
And with respect, I'm going to make a motion to approve the October 1, 2024 minutes and to defer the September 3rd, 2024 and the May 13th, 2025 minutes.
Thank you.
That's my motion.
Second.
Any discussion? Ms. Erica, can you call the roll?
Yes, ma'am. Mr. Bailey.
Aye.
Mr. Brennan. Ms. Herbert.
Aye.
Thank you.
All right, next on our agenda is the public hearing. And this is going to be the 2025, 2029 Consolidated Plan and 2025 Action Plan. And I am going to turn this over to Ms. Felicia Kilgore. And you can introduce any other folks that you may have with you as well.
Excellent. Well, good morning.
Good morning.
To the members of the Community Development Committee, council members. We're here to present the second public hearing of the United States Department of Housing and Urban Consolidated Plan. We've been working on it for a number of weeks and months, and so now we're ready to present the final second hearing. So this plan is a federally required document that outlines the City of Columbia community goals, priorities for housing, community development, and economic opportunities, particularly for low to moderate income individuals in the City of Columbia. The purpose of the second hearing is to provide an opportunity for our local residents to make additional comments as relates to our plan as well as our action funding recommendations. It will outline our activities and funding for our Community Development Block Grant, which we refer to as our CDBG, as well as our Home Investment Partnership Program, which we refer to it as HOME, as well as our Housing Opportunity for Persons with AIDS, which we refer to as HOPWA. So we have, via virtual, our consultant that we've been working with for the past several years, Mr. Eric Chatham with Civitas. And then also we have our chairperson with our Citizen Advisory Committee, Ms. Sierra Harris here, that has been instrumental along with the entire committee in terms of our awards with our subrecipients. And then also our staff on the compliance side with Dolly Heron, our administrator, and the compliance team. And so I am going to actually right now turn things over to Eric, and he will actually go over the draft for the consolidated plan.
Thanks, Felicia. Good morning, ladies and gentlemen. I advanced the presentation just a little bit as Felicia was doing her introduction. On the screen now, you see the 3 grant programs that the city receives as being an entitlement community. What I'm showing on the screen now is the typical eligible activities for each of the 3 programs. This is not to suggest that this is what the city always funds, but as a little bit of background information, want to make sure everybody was aware of what we can and cannot fund with each of these 3 grant programs, so that we have a point of reference when we make these recommendations. Not all things are eligible. Specifically on the Community Development Block Grant, wanted just to draw your attention to the public services. I know we've discussed this in previous public hearings and presentations, but the city is limited to only 15% of our annual allocation to go towards public services. We often fund city programs as well as nonprofit organizations may apply each year for funding. And we're certainly oversubscribed or have more requests for that funding category than we're able to fund based on that 15% statutory cap. Additionally, with the Community Development Block Grant, while we can do housing rehabilitation and we do purchase assistance programs and do a lot of housing activities with CDBG, unfortunately, we cannot fund the new construction of housing, which I know is certainly in great demand. That's why you see on the home program, that's largely been where the city has been able to fund new construction of housing, largely rental properties as of late. I also want to remind everybody that those two programs, the city only funds within the city jurisdiction. Richland County, Lexington County both received those grants themselves as well as the state. So they worry about and fund things outside the boundaries of the city limits. But for the HOPWA program, the city administers for a multi-county jurisdiction there in the Midlands. So it's worth noting we have a little larger allocation of the HOPWA funds, but we do administer on behalf of a larger service area than just the city limits there. On your screen now, you can see the 2025 funding allocations. The last time we presented, we were still working with estimations. At the federal level, all three of these programs were funded what they call to level funding or flat funding from the fiscal 2024 budget. And our numbers were relatively close when HUD runs the formula. Still, the allocations are a little slightly different for each jurisdiction, but at the federal level, these programs were level funded compared to 2024. So you see on the CDBG program, the city will receive about 1.1 million. The home program, 660,000, and the HOPWA program, 1.9 million. The consolidated plan, as Ms. Kilgore mentioned, is out for public comment. We have the full draft ready. When we're finished with our outreach and council presentations and approval, we'll be ready to submit that to HUD for their review and approval. There are 5 major sections of the consolidated plan: the needs assessment and the market analysis is where my team at Civitas largely helped out with community outreach events to assess the needs of our community, as well as a housing market analysis. With that information and with information and feedback from stakeholders, residents, as well as council in this committee, we identified our priorities and goals in the strategic plan. And then as Ms. Kilgore mentioned as well, now with our annual action plan for the 2025 funding, we have our specific project budget, which I'll be sharing with you momentarily. And then finally, our citizen participation efforts, which we started many months ago with a variety of community meetings and surveys, and now with the multiple public hearings and comment period. So on your bottom right of your screen there, the citizen participation, just a quick reminder of our community events. We hosted 4 in-person meetings around the community back in December. We also had surveys open at that time for both residents and stakeholder organizations. Obviously, we're here today on our second of 2 public hearings. The first one was back in April. And our public comment period is now concluded technically, but of course we are open for public comment again today as part of this public hearing. Once we complete this process and go through council's approval later this month, as I mentioned, we'll be ready to submit to HUD, and our program year would then start on July 1st. From our community survey, we had 159 responses to the survey, again, as well as multiple in-person feedback opportunities. Affordable housing continues to be our top priority from our residents. That's why I think it's important to point out that with our CDBG funds, we cannot fund new construction. So one of our main 2 programs there for housing, we're limited. And then of course, with our home funds, where we can do new construction, we're only receiving $660,000. So new affordable housing development is very difficult with that amount of funding and with the limitations to the CDBG program. But the city, of course, as you're all well aware, puts significant resources and effort into both the rehab program and the down payment assistance program with both sources of funding, CDBG and home. Under the CDBG program and the HOPWA program, that second priority there are public services, mental health services, homeless and child care services. Again, want to recall that under CDBG, we're limited to only 15% of that allocation to public services. And with the HOPWA program, the overwhelming use of that fund is for emergency rental assistance, utility and mortgage assistance, and that it comes with supportive services and homeless prevention and health services for those populations. So our top two priorities from the public are unfortunately with our funding limits and the stipulations of the three grants were very difficult to really truly serve and dedicate all of our funds to those two priorities. So then the third priority, and it's our second biggest use of the CDBG funding, is public improvements. Street improvements, sidewalks, and neighborhood cleanups were the top priorities from the resident feedback. And of course, the city has used these funds over the years for a variety of public facilities, libraries, community centers, parks, and of course, streets and sidewalks, etc. So with all of this feedback, this analysis, and the deliberation with staff and the committee and council members, as well as residents and stakeholders, we've identified the following priorities on the left-hand side with a little bit more specific goals on the right-hand side. So these are not in ranked order per se. So just the first priority, but again, not necessarily the top priority, is to expand and improve public facilities and infrastructure. Again, sort of the second largest use of CDBG funds. And so goal to address those facilities and infrastructure improvements. Under the second priority of preserve and develop affordable housing, here's where we get a little bit more specific with our goals. So affordable housing opportunities with the home program, that looks like new construction of both ownership and rental opportunities as we have developers applying for those funds. Provide for housing rehabilitation, code enforcement in low to moderate income neighborhoods, and slum and blight removal in residential areas. Then public services and quality of life improvements, again, CDBG, public services, as well as to some extent HOPWA funding for supportive services for those clients with special needs. Then housing and supportive services specifically for persons with HIV and AIDS. Then with our CDBG funds, and then with this committee a few months back, we discussed small business opportunities and economic development. So a portion of the CDBG funds each year will go towards an economic development opportunities. And then we use a portion of each of the three grants, of course, to fund the administrative expenses, largely varied by the city staff. And HUD requires us to associate all of the funding with one or more of the priorities and goals. So our final priority and goal is simply effective program management. That's really, in my opinion, that's kind of obvious. We of course want to have effective program management, but that's one of those technical pieces from a budget alignment standpoint that HUD wants to see there.
Eric, I have a question.
Yes, ma'am.
And this is more for the audience. So under the citizen participation survey highlights, number one was affordable housing and number two was public services. But when we do the PON plan, we start off with number one being expand, improve public facilities and infrastructure, which is number three. I think what I heard you say is that's also because the need is so great with affordable housing that the money that we have would not have the impact that you think it should have?
Well, no, really, these are the priorities and goals are not in ranked order here. They're largely just based on the percentage of funding to some extent that the city will allocate. Again, under CDBG public services, while that might be a high priority, we're limited to 15% So, I mean, we could certainly swap these and call this a ranked order if you would rather see preserve and develop affordable housing as the top priority. But this is just a simple list. It's not a ranked order.
Well, no, and you don't have to change it. I was just thinking it through and then trying to help the citizens that might be here to understand the difference in the numbers, but go ahead.
Well, and to address that, again, with the home program, we only received 660,000. We rely, the city obviously does not build and develop its own housing. We put out RFPs and request both for-profit and nonprofit developers to request those funds. So to some extent, we're relying on third parties that are doing this type of work, and there's certainly plenty of those organizations that do work in the city. But with 660,000, that just doesn't go a long way. Even if we put all of the home money to new construction, new apartments even cost $300,000 to $400,000 per unit to build multifamily apartments. Even new construction of single family housing, even when groups like Habitat for Humanity do that, still can have expenses well over $200,000 or $300,000 to build those houses. So we're absolutely agree that affordable housing is the top need. But with the limitations of our funding, both from a regulatory standpoint and just how much we're actually receiving, we're limited in how much impact we're really going to be able to have with affordable housing. The city certainly puts a substantial portion of the CDBG funding into purchase assistance and housing rehab programs, again, as well as code enforcement and removal of slum and blighted properties in neighborhoods. So a lot of funding is still put into that category, but again, the impact or the outcomes because of the sheer cost and the limitations of the CDBG program not being able to use those funds for new construction just really limit what we can accomplish, unfortunately.
And Mr. Bailey has a question.
Hey, Eric, question. How does our allocation this fiscal year compare to, I guess, prior cycles? Is it comparable or is it lower, would you say, for 25?
I can look at the comparison. Felicia may know that off the top of her head, but again, it was essentially level funded at the federal level, so it was within a few $1,000s. Let me go back. I have that on my notes here. I can find it precisely.
So Eric, I do have that. In terms of our CDBG allocation, we did go up a little bit in our CDBG allocation, up about $30,000. For our home funds that we discussed, it went down about 49, almost 50,000. And then we had a lift in our Hopper dollars. It went up to about 9,000.
Thank you.
Yeah, and I just went back to the funding screen there just as a point of reference for what this year's allocation is.
That answers my question. Appreciate it.
Yes, sir. Any other questions on this slide before I proceed?
No, doesn't look like it.
Okay, very good. Okay, so moving forward to the recommended funding for just the 2025 year. Every year when the federal budget is passed, the city will receive new allocation, and you'll continue to have an annual action plan every year. This consolidated plan covers our priorities, if you will, for the next 5 years, but it includes only the budget for 2025. Of course, we don't know what we're going to receive moving forward. So our projects from a HUD perspective are really synonymous with eligible use categories. And then the city will work through Community Development Office to fund specific agencies and specific activities. What HUD requires is at the project level or really the eligible use categories. So that is kind of what I'm showing today. In CDBG, the admin and planning, reminder that is capped at 20% of the funding. The city does generate a substantial amount of program income each year where people are repaying loans, for rehab or purchase assistance each year. You can see at the bottom of your screen, we're estimating this year $650,000 in program income. I have said this before, but I really like to brag about the City of Columbia's program design from, at this point, decades ago, where you have made the hard choices long ago to allocate funds and require a repayment. And in some cases, those are no interest and only deferred, and people are making very small payments. But this is, over the decades, this has amounted to a pretty substantial amount of additional funding generated each year. So again, this year we're estimating $650,000 in CDBG program income. And we're also reallocating about $954,000 of funding from previous years that for whatever reason the projects didn't use all the funds, or projects were eventually determined not to be feasible. So we're using this opportunity to reallocate. So that's why you see the total budget here is much higher than the actual annual allocation. So we're taking 20% of the annual allocation plus a portion of the program income for planning and admin. A little less than 15%, $170,000 of the annual allocation for public services. Then our two largest categories, as we discussed on the previous slide, public facilities and infrastructure for $930,000, and then the combination of the housing programs, both purchase, rehab, code enforcement, and slum and blight removal at $1.4 million for the combination of housing programs. The home program, we're able to allocate up to 10% of our allocation for administration. So we're right at that number with $66,000. We're required to set aside 15% of our allocation for CHODOs, CHDO, that stands for Community Housing Development Organizations. Those are our nonprofit affordable housing partners. The city has a number of those that you work with from time to time. So we're setting aside about 15% for those organizations. And then the balance of the funding, just under $1.1 million for affordable housing development. And that's where I previously mentioned we rely on both for-profit and nonprofit partners, including those CHODOs, to apply for funding as they have feasible projects. As you can tell, with $1.2 million in total, the city is not really able to fully fund projects. So we typically subsidize a portion where we get 2 or 3 units, perhaps in a multifamily apartment that are dedicated to low to moderate income individuals and households. Like the CDBG program, the home program has been repayable for many decades now, and the city generates almost an equal amount of full allocation of program income, $600,000. So that's nearly doubling our allocation this year because of the way the program was designed. Most communities, and I work all over the country, and certainly here in South Carolina, most communities try to avoid program income because of the complications and management that creates. But as our funding has continued to be subject to cuts at the federal level over the last several years, this has really put the city in a great position to be able to maintain these programs, even with the uncertainty at the federal level. So again, to commend the city's decades-long stance or policy now, if you will, to have these as repayable programs.
And I have a question, probably better for Felicia. So CHODOs max out at 15% of the annual allocation. And at some point, it seems like I remember we had very few eligible
Yes.
CHODOs.
That is correct. Currently, right now, we don't have any CHODOs.
Okay, so
That's
there's
been
still is a
certified.
need.
That's been
Okay.
certified.
Because I was wondering if it's only 99,000 that's available per year, do we still need to be concerned about creating them? But if we only have 0, we have none that are eligible.
Yeah, but those dollars can accumulate, beyond the 99,000. So we still want to seek CHODO organizations.
That
So we
money
can
can
allocate.
carry over, is that what you're saying? But yeah,
Yes.
but so right now, the city of Columbia does not have any certified CHODOs.
That's correct.
And at a couple points there. So the CHODO, I understand that there's not perhaps organizations certifying currently, but where they're certified CHODOs, they're not limited to the 15%. They could still come apply in that sort of larger pool. We're required to set aside 15% for only those organizations.
Gotcha.
Two things to address there. First, the home grant is good for 9 years. So as Ms. Kokor mentioned, we can accumulate these funds and so stockpile them, if you will, until we have feasible projects and feasible certified CHODOs. HUD has recently, just as of a couple months ago, modified the rules for how nonprofit affordable housing organizations can certify as a CHODO. It's my experience so far helping a couple other communities that has been favorable to many nonprofits that historically were CHODOs. The rules changed about 5 or 6 years ago and it became more difficult. And now they've gone sort of back to being a little bit easier to certify. So under those new rules, you may find some of the previous organizations are now able to recertify as CHODOs. And in the event that still doesn't help, we have a waiver process that if we make efforts to identify CHODOs and are unable to, we can request HUD, after we prove that we've made that effort, we can request HUD to waive that set aside and then essentially just put that money into the larger funding pool for development from non-CHODOs. So several opportunities there with the CHODO set aside.
Thank you.
Yes, ma'am. Okay, on the HAPWA side, HUD does require us here in the annual action plan to identify the agencies that are going to administer each of the HAPWA funded activities. So you see the city is taking a small portion for administration, just $57,000, and then each of the agencies here. And these are longstanding partners with the city. You've been funding these same organizations largely for the same programs year over year. So there's a long track record here with each organization. So the Housing Authority for 721, almost 722. The Palmetto AIDS Life Support or PALS program for 496,000. The Cooperative Ministry for 250,000. University of South Carolina Department of Medicine for 358,000, and then the Upper Savannah Care Services for 25,000. And I'll minimize the share here so I can see you guys a little bit better. But so I believe we are pending the council agenda for the 17th for formal adoption and approval from council. After which we will be ready to submit to HUD on or before July 11th. When HUD approves the plan, they will essentially make the effective date of our grant agreement July 1st. So we're delayed as everybody is because of the funding or the budget process at the federal level, but that will not cause us an inability, if you will, to start expending these funds as of July 1st. They will authorize that once the plan is approved. So for our members of the public, if they still seek to provide any feedback, of course we can take that today. And then you see the website where the plan is available, as well as community development address and phone number where they can be contacted. And so with that, I'm happy to answer any other questions. But I'll stop there.
No question.
Mr. Brennan?
Felicia, thanks for this information. The Upper Savannah Care Services for the HAPWA is a large region that we service through our pass-through funding. What county is that Upper Savannah overlap in for the $25,000 funding?
I think that's Greenwood. Saluda.
Saluda, okay, so close to home. All right, thank you.
Any other questions from members of the committee? So I did just have one, certification of the CHODOs. Do we do that or is there a separate certifying entity that does it.
Right. We do that in-house. We have an application process that, they go through while submitting supporting documentation to support, the certification requirements. And so we do that in-house.
So are there's home builders? Describe to me.
There's generally nonprofit organizations. We have had one in the past, a few years ago. We worked with community assistance providers. They qualified, as well as Homeless No More. So
what's the information share, the application to be confirmed? Is it long? Is it easy?
it's easy. It's basically, it's financials, showing that you have liquid assets up to 50,000 that you generally maintain, that kind of thing. Number of years experience that you've been supporting affordable housing and managing rental units, things of that nature.
And so,
Barriers that we often hear from nonprofits is there's a requirement that at least 1/3 of their board be
Has to be.
either low-income individuals themselves,
Correct.
live in a low-income neighborhood, or represent a low-income constituency. And a lot of nonprofit boards, of course, just to be frank, they want people on the board that are going to be able to bring big donations and contribute somehow. And they don't see the value. I'm just being frank. They don't see the value of having 1/3 low income. And so that is often a barrier to getting organizations certified. HUD has specifically modified who counts to meeting that 1/3 low income representation. And I believe that has should make it easier for nonprofit affordable housing developers to meet that requirement. And then, as you said, as Ms. Kilgore mentioned, they've still got to be a viable affordable housing developer. They've got to be able to do this. The city doesn't advance funds, right? So they got to have the capacity to vet projects, identify projects, get financing, put properties under contract, work with contractors, engineers, architects, etc. City's not going to do that for them. And unfortunately, there's just not a lot of capacity in the nonprofit sector for that type of work. I'm down here in Charleston. City of Charleston doesn't have a CHODO right now. Myrtle Beach doesn't have a CHODO right now. Spartanburg has precisely one. Greenville has two. And so I mean, there might be 3 CHODOs in all of South Carolina right now.
well, one thing I will say is I am glad that they hold the boards to the line of having the people that you serve as a part of the board. Because that goes back to planning with people and not for people, and bringing folks through the process. So I actually like that part, and if that's the reason that's keeping folks from getting there, then honestly, to me, that's a good reason for them not to get it if they don't have that sense of valuing the people whom they serve.
And that's a requirement to be in their bylaws too. So that's something that's got to be an organizational standard ongoing. It's not something that they can just put somebody on the board, get certified, and and let them drop off. That they have to continue to recruit as their board changes.
Mr. Brennan has a question.
So Eric, this CHODO set aside we're talking about is roughly $100,000. Is that pretty consistent minimum? Has that been pretty consistent where we're at over the past years?
It has.
Yes, sir. That 15% has been the standard since the home program was initiated in the early 90s.
So the uses for that set aside, does it have to be specifically for the actual construction of houses through a nonprofit, or can it be through mortgage assistance through nonprofits towards new construction?
It has to be for development. And so that's a really good question, because why wouldn't we just let a nonprofit do housing rehab or purchase assistance program and use that money? Those are not eligible CHODO activities. We can partner with nonprofits to run those programs if we were so inclined, but the CHODO set aside has to be for housing development. It can be acquisition and rehab for resale. It can be new construction, but it has to be for development. The funds can be used for the hard cost or the soft cost to buy the land, any of the eligible expenses, but the ultimate project itself has to be true development.
Well, you said yourself you've worked with a lot of municipalities. What are some creative ways that municipalities are working with nonprofits when it comes to making that Chodo set aside of 15% really the biggest bang for the buck?
Well, most cities have recently either just taken HUD up on the waiver to get the waiver on the Chodo, or they've gone to substantial effort to provide additional technical assistance in training, capacity building. You are able to set aside an additional 5% of your annual allocation for Chodo capacity building. I mean, we don't get a whole lot of money, and so even 5% of 660 is that's not going to be much, 30-something thousand. But I work with, Spartanburg County, for example. They have one Chodo, but every year they give them that 5% for Chodo operating, so that helps them increase their capacity a little bit. I work down in Jacksonville, Florida. They have 2 or 3 Chodos, but the same thing. They provide the maximum in operating assistance. Both of those communities receive a little bit more in home funds than Columbia does, though. So I mean, it's if we give a nonprofit some operating money, that's one less house we might be able to build or subsidize. So it has its trade-offs certainly, but if the city is so inclined, helping with operating expenses and capacity building funding would likely be necessary.
All right, thanks, Eric.
That just made me excited, I'm sorry. Any other questions from our committee members?
No, ma'am.
None.
Well, great job. Now, are we gonna have another part of the presentation from the committee?
If there are more questions that you may have,
Well, no, I just wanted to know the right time to ask them all to stand up and be recognized and their names. I don't know if that's now or later.
so I'd like to have Ms. Sierra Harris, which is our chairperson for our Citizen Advisory Committee.
Good morning, esteemed members of City Council, members of the Community Development Committee, and my fellow community members. I'm really excited to be here. It's my first time being the chairwoman in my first year on this committee. My name is Sierra Harris. I serve as the chair for the Citizens Advisory Committee for Community Development. Our committee ensures that citizens' voices are amplified when developing the consolidated and annual action plans. In accordance to the guidelines set by HUD, we, being a committee solely composed of citizens, are actively involved in the planning, implementation, and the assessment of the consolidated plan programs. So today I have the honor of presenting to you all the recommendations for the Community Development Block Grant, as well as for the Housing Opportunities for Persons with AIDS grants programs. So the funding amounts that I will present have been processed and finalized by the City of Columbia's Department of Community Development. I'm going to start with the Community Block Grant applicants. So our first applicant is Fast Forward. This agency will provide 80 individuals with services to overcome barriers to employment and achieve economic stability through personalized support and workforce development programs. Our recommended public service amount for Fast Forward is $25,000. Next, we have the Mental Illness Recovery Center, or MERCY. This organization will engage 65 women and female youth, including screening participants for mental health needs and vulnerabilities, and enrolling them in MERCY's behavioral health care services where applicable. Our recommended public service amount for MERCY is $52,000. Next, we have the Palmetto AIDS Life Support, or PALS. This agency will serve 100 clients to empower persons living with HIV and AIDS by focusing on essential life skills needed for independent living, managing daily responsibilities, and increasing household stability. Our recommended public service amount for this organization is $30,000. Next, we have TN Development Corporation. This organization will provide renovations to the Oak Hill apartment complex. They'll do things such as install mini splints, replace the roof, painting the building, replacing lock sets, demoing and installing new showers, installing one gas tankless hot water heater, installing attic insulation, and replumbing each unit. Our recommended non-public service amount for this organization is $245,000. Next, we have the City of Columbia Homeless Services. The funding will be used to upgrade their kitchen into a fully equipped commercial facility. The kitchen will give job training opportunities, life skill developments, and improve the meal service. Our recommended amount for public service is $63,000, and our recommended amount for non-public service is $133,000 for a total of $197,000. From there, we have the City of Columbia Parks and Recs. This funding will be used to upgrade park amenities to enhance the quality of life for LMI persons who live near Lork and EB Sessions Park. Our recommended amount of funding to this organization is $252,000. And finally, with the CDBG, we have the Columbia Empowerment Zone. This funding will be used for the station at Congaree Point. The funding will aid in the completion of infrastructure improvements, the installation of water and sewer systems, sidewalks and curbing, development of roadways, and street lighting in this low to moderate income area. Our recommended amount of funding to be provided to them is $300,000. I'll now transition and go to the funding that we're recommending for the housing opportunities for persons with AIDS grant applicants. Starting with the City of Columbia, this funding will be used for administration, salaries, oversights, monitoring, and compliance. Our recommended amount is $57,000.
Hold on for 1 second.
Yes.
Page 20.
I have this copy right here. I don't think you have a copy of the HOPWA.
Okay. Thank you.
You good? All right.
Yes.
Do you want me to say the City of Columbia again?
Well, let's,
Give
can
us 1 second.
Okay.
we take a quick break? Get
Yes.
copies?
Mr. Bailey needs to take a quick break, so can we take a 5-minute break? Everyone, I'm sorry for the interruption. Thank you. You good? Thank you, Ms. Harris, if you can
course.
continue.
All right, so I'm gonna jump back into the grant applicants for the housing opportunities for persons with AIDS. Starting again with City of Columbia. This funding will be used for administration, salaries, oversight, monitoring, and compliance. Our recommended amount is $57,000. Next, we have the Columbia Housing Authority. This funding will be Housing Authority 1, excuse me. This funding will be used for tenant-based rental assistance that serves 55 clients for a total of $543,000. Next, we have Columbia Housing Authority 3. This funding will be used for tenant-based rental assistance that will serve 15 individuals for the Housing First Hopper program for a total of $157,000. Finally, we have Columbia Housing Authority 4. This funding will be used for tenant-based rental assistance that will serve 9 households and allowances for monthly utility costs, maintenance and repairs, and administrative costs for a total of $20,000. The total amount that is being recommended to be awarded to the Columbia Housing Authority is $721,000. Next, we have the Palmetto AIDS Life Support. The funding will be used to cover salaries and fringe benefits at various percentages for client supportive services for 2,200 clients. The total amount recommended is $496,000. Next, we have the cooperative ministry. The funding will be used for short-term rent, mortgage, and utility and related support services for 228 individuals and households. The recommended amount for this organization is $250,000. Next, we have Upper Savannah Care Services. The funding will be used to provide short-term rent, mortgage, and utility assistance for 5 individuals and supportive services for up to 40 individuals and their households. The recommended funding amount for this organization is $25,000. And finally, we have the University of South Carolina's Department of Medicine. This funding will be used to provide housing information, permanent housing assistance, and supportive services for up to 545 individuals. The recommended award amount for this organization is $358,000. So that is going to conclude my report. I want to say thank you on behalf of my committee for this opportunity to learn more about this process and to provide our insight. I'll pass it back over to Director Kilgore.
Are we going to get the rest of the committee members to
Oh,
stand
yeah. It's only a few
up
of
and
us.
get their names?
Yes.
Pat Meyer.
Hi, Ms. Clark.
Wanda Cannon.
Hi, Ms. Candy. Just the two? Oh, 2 of my favorite people. Thank you. We appreciate you all serving and coming to the meeting today. That's pretty cool.
Madam Chair.
Yes, Mr. Bailey.
I have a few questions.
Certainly,
Starting with the Lower Park and E.D. Sessions Park improvements.
yes.
Were any other parks considered for improvements?
Those were the parks that were submitted for the requesting for funding. So they may have more parks that they would like to include in the fold, but that's what we received for now.
Okay, and I'm pretty sure Mr. Simon's department was involved with that, correct?
I would certainly hope so. I know Kenya wasn't the person in charge of submitting the application.
They are, Mr. Bailey, and they do look too at sometimes what have been targeted areas. They try to collaborate with, those areas that I guess, have, housing needs also in the community, things that go along with the other factors that the CDBG.
That we have to tie back to low to moderate income
Existing
areas.
Yeah,
Underway.
finishing projects, that type of thing.
So I do have, do we just need to rely on this one and not rely on this one?
So the one that you have is a good source because it includes the CDBG as well as the HOPWA allocations.
Okay, so I was just checking, so on one document, it's 252. That's recommended for Lorik Park, but then it's a different number, 221. Is that maybe because of how much money was available?
Yes.
Okay. So we're gonna use this one. Are y'all paying attention? We're gonna use this one. Don't use that one. Okay.
Yeah, the difference was the $30,000 increase that we received from the new allocation. Once we receive our 25, 26 allocation, it was a $30,000 increase in the CDBG. And so we made the necessary adjustments.
Don't
I
do
did,
that.
I'm saying.
Yes. I thank you, Mr. Bailey, for being concerned about getting it. All right, so does that conclude the information that you all have to present?
Yes, ma'am.
Madam Clerk, has anyone signed up to speak today?
We did not have sign-in sheets posted, however, if you will open the public hearing and individuals are here to speak, we will run timers, each individual will be allotted 3 minutes, and we can move through the public hearing process.
How many minutes? I'm sorry.
3 minutes per speaker.
Okay. All right, so we are now, it is 12:05, and we are going to open this meeting for a public hearing and allow any individuals who may be here to make a public comment. If you have a public comment about this report that you just heard, we were going to ask you to stand at the podium, give your name and your address, and let us know what your comment is. And you have 3 minutes, and I'm gonna do the time too. I like time. Is there anyone that is here that has a public comment? Maybe even just like someone who's getting some of the money in here who may want to say thank you for this. I'm just throwing it out there. Oh, Larry's a taker. So we can have something in a public record.
Good morning, Madam Chair. I'm Larry Sally with the Greater Columbia Community Relations Council and resident of the city. As a longtime nonprofit housing developer, very familiar with the programs. I certainly applaud the committee and council for their efforts and support for public housing and, of course, affordable housing. I do agree with the committee that affordable housing, the development of affordable housing, should be the priority. In order to get residents into the city, in order to have a balanced diversity of people, diversity of character, you have to have housing. There's been more of a focus on, rental housing, which is, alleviates the problem on the front side, but of course, it does not develop any wealth. Most families, if they want to stay in the city, they're going to have to be able to afford to move into the city and maintain their homes. I do, of course, appreciate the work that you all are doing through your rehab program. I think maybe the best use of dollars probably to do training for other not-for-profit developers. Their margins are very low, very small. If for-profit builders are making very little money, not-for-profit developers are not making any. And it's hard to maintain a staff, keep people certified, ensure that the programs meet HUD and the city's guidelines if you don't have proper staff. So I would recommend that they consider providing more training and more support to those organizations because in a sense, those are the partners of the city themselves. They're actually carrying out the work. So you want to ensure that you have the best partners working on your behalf. As far as the Chodo piece, we've been a Chodo for some time. One thing I'll say is that the changes in the guidelines, as the consultant said, were probably one of the issues that created a problem there. They have modified those somewhat in terms of the comment about the individuals who apparently want to not have people that live in those communities. I agree with you wholeheartedly. Anyone that does not want input from the people that they're serving at that level, the city should not consider partnering with them. We had that at the CDC for years. It served us well. And I think, one of the tricky parts is, for example, the board composition, which is an issue. If you have an individual who's low income, who works at let's say the school district, according to HUD's guidelines, they're considered to be a public employee. So they don't qualify as a low-income resident. That means now their service on that particular board does not qualify as low income. So that might kick them. But, you know, effectively, I think that's the strategy. So I wanted to thank you all for that, because a lot of the municipalities are not putting their money back into, you know, working with the most vulnerable groups in our community. All do, and you should be applauded for that. That's
Does your organization have a luncheon coming up?
We do. Thank you, Mr. Bailey. Of course, one of the things that we do at the CRC, we celebrate individuals working in our community. June 18th at the Metropolitan Convention Center, we'll be having our 61st annual luncheon. www.greatercolacrc.org. We'll share it with the city, but thank you all, and we hope you'll come out.
Is it Mayor Rickaman being honored?
Oh, my goodness. And he's going to throw me out here. Of course, yes, Mayor Rickaman is being honored, as well as some other officials from around the area. We seek this year to celebrate projects that are improving in Columbia. So we'll be, of course, recognizing Governor McMaster, Secretary Lightsey for their work, as well as, Senator Walker and Paul Livingston on Richland County Council for their work to our area, which is going to create some economic benefit. And we'll be recognizing individuals that help with the Penny Tax Initiative, and Mayor Rickaman, Councilwoman Jessica Mackey, and several other individuals are all a part of that. So it's a very diverse group. We're working on both sides of the aisle, and this is what Columbia, we're going to celebrate that day. So you all come out, let's support the mayor and support the other honorees. But please come, 12 o'clock, June 18th. Thank you.
Sally, I just want to thank you and reaching out to people in my immediate family who have made sure to remind me about this event.
Yes, ma'am.
And make sure that it's on my calendar. I appreciate your diligence, because I need that kind of reinforcement.
Well, I appreciate working with your family and with the community and with the city. They've been good partners with the CRC, and we hope to continue that.
Thank you. And we have one other person.
Good afternoon, Madam Chair and members of the council, and to all of you here present. My name is Alton Cobb. I serve as Director of Housing Services at PALS. And we have had a long relationship with the city in providing services and housing for persons living with HIV in the state of South Carolina. PALS is the oldest HIV/AIDS organization in the state. We're the second oldest HIV/AIDS service organization in the nation. So we've had a long history of providing housing services to individuals living with HIV. This year marks our 40th anniversary, and we plan to have a joyous occasion planned sometime around October of this year. Invitations will be sent out to the city as well as other organizations around in the community. I just want to say thank you to the City of Columbia and the Office of Community Development, the Citizens Advisory Committee, for their diligence and their service and the awarding of funds to PALS to provide housing services to persons living with HIV. It's been a pleasure. This December, I will have been at PALS now for 27 years. And in that time, we have seen our service area grow as well as our numbers of people that we serve grow. But the persons are very appreciative of what we do in terms of providing housing services. And as we say in the business, housing is health care. People don't realize that if persons don't have stable housing, they don't have any place to keep their meds. They have a very low tolerance for being stabilized in housing, as well as being making sure that they are compliant with their medical regimen. So on behalf of our CEO, Carmen Hampton Julius, and the staff at PALS, we say thank you so much for the opportunity to provide housing services through our Housing Opportunities for Persons with AIDS program. Thank you.
Thank you. Thank you so
Mr.
much.
Cobb, one
Sorry.
quick second, sir, while you're up there.
Question.
I wanted to ask you a few questions, and first and foremost, thank you for everything y'all do at PALS. You know, we're all in it together right now with this homeless epidemic that is sweeping not only our state, but our country, and we feel it locally. Significant funding is being dedicated towards the all-hands-on-deck approach for homelessness here at the city and our nonprofits. And can you just take a second and speak to the homeless work that you do at PALS when it comes to this funding that comes through the CBDG funding summary and the HOPWA funding summary?
Basically, what we try to do is identify persons in our community that are at risk of becoming homeless. That gets to be a task sometimes because people don't like to identify themselves as being homeless, but we have to go out and make sure that our clients are being served with the funds that we are provided in terms of providing the housing that is needed. And we try to do our best in terms of making sure that our clients are stably housed through case management and outreach that we do in terms of making sure that they are stably housed.
And I'm sure you work with partners in the area to identify folks in need of this service.
Yes, we do.
So what partners can you name a few?
Well, we have the shelter, the homeless shelter.
Rapid Shelter, yeah,
Yes.
absolutely.
We work with the cooperative ministry, and we also use other homeless providers such as Homeless No More. We also use the University of South Carolina, our immunology center, who recommend people to us for housing services, as well as other medical providers. So we look to partner with various entities in the community.
Well, fantastic. Mr. Cobb, I appreciate y'all's willingness to partner, especially with the Rapid Shelter and everything the city's trying to do to cut into the problem of homelessness that faces all of us. So, thank you to PALS.
Thank you.
Thank you.
And we have one more. Please, wait till you get to the mic.
Good afternoon, everyone. I'm wearing two hats. One, I'm the board chair for TN Development Corporation. And also, I am the Senior Vice President of Resident and Strategic Initiatives for Columbia Housing Authority. I stand here to thank you all for the allocation of funding for both organizations. Affordable housing is not just a Columbia issue, as we know it's a national issue. I was just on a meeting with the National Housing Association yesterday for a conference we're having next month. And one of the questions they asked about, what are you guys doing to handle affordable housing in your community? And during the conference, I have to speak about what we're doing here in Columbia. So I'm proud to take this information back to this National Association, talk about what our local municipality, the city of Columbia, is doing to address the affordable housing issue and homelessness within Columbia. As we know that housing is a basic core need. We expect for our kids to go to school to learn. We expect people to be healthy. We expect people to go to work and have living wage jobs. but without affordable housing, none of that is possible. So I would really like to thank the City of Columbia for your generous allocations to both Columbia Housing Authority as well as TN Development Corporation. You guys make it possible for us to help people to self-actualize, to become self-sufficient, but also to raise their families in healthy homes in places where they hopefully can have a bright future. So again, thank you guys.
Could you please state your name for the record?
Oh, I am Talisha Stewart.
Thank you, Ms. Stewart.
Yes, thank you.
And we have one more. Another, I shouldn't say one more, not limiting anyone. If you could state your name. Yes.
My name is Caroline Cedar. I'm with University School of Medicine, Supportive Housing Services. Also with Prisma Health, we're a little bit of a mix, so it's kind of confusing sometimes. So I just wanted to come up and thank the city for our HOPWA allocation this year, as well as our regular Housing First allocation. We were just discussing homelessness, and Talisha came up, and it made me, really think about our partnership with the Columbia Housing Authority, and we talked about partnership and our Housing First program, which many of you may be familiar with, that all aligns with our HOPWA program. And we essentially assist clients that are experiencing chronic homelessness and connect with the Housing Authority and provide wraparound case management services to those clients. So the funding from the city assists us in continuing those services for those clients who are extremely vulnerable, the most vulnerable in our city. And we also partner with the Rapid Shelter consistently, as well as Transitions, as well as Mercy, as well as Columbia Area Mental Health. Anybody we, try to bring in, we just try to partner with anybody we can if we have the service available to provide. So I just wanted to come up and thank everybody with the city for those allocations that we receive, and we'll continue to do the work and, provide those services moving forward, and just wanted to thank you.
And can you expand, just for those who may not know, the service that you provide that I consider different than a lot of the other supportive services?
So for our HOPWA program specifically, this is pretty similar to PALS and Cooperative Ministries. We provide the rental assistance as well as permanent supportive, first month's rent and deposit assistance. We also have a counseling program, so we provide mental health services free of charge in-house for any clients who are in the community that are in our program, as well as group mental health services, music therapy services, and then the wraparound case management services that I was speaking about. We partner heavily with the Columbia Housing Authority. I speak with Talisha and Ashley over at Columbia Housing almost daily for our 41 clients that we have with them in the permanent supportive housing program. And we provide monthly home visits as well as monthly office visits, mental health appointments, medical adherence assistance. We have a medical adherence educator on staff who takes clients to medical appointments, helps them understand their medication, refills, just understanding the jargon in a medical appointment, that kind of thing, so they can be more, able to understand when they need to take their medication and that kind of thing. And we also have an outreach team. We have 2 outreach workers that work with our homeless population and connecting with clients with resources. If they don't qualify for our program, we always try to provide a warm handoff to an agency or organization that can assist. So we're not just giving a resource guide and saying, go. We're trying to actually give that warm handoff and bringing them to that organization where they can get the assistance they need. So we really try to provide that wraparound service. It does take more time, I would say, more efforts from our case management team. So maybe our caseloads may not be as high as other agencies, but we do provide very quality care for the clients that we serve.
And are your clients in permanent housing or working towards? That's the part I really wanted to emphasize.
Yes, we have 41 clients. I believe it's less now. I think it's 39 right now in permanent housing with Columbia Housing Authority. And we case manage those clients and we work with them to kind of, they do program or the property management, and we do the case management for their mental health, substance use, medical care, their housekeeping, making sure they sustain in that housing and they're not evicted for those reasons.
That part.
So I think that's the big part that can be,
that's the part.
that can be the part where it falls apart. And so we really try to wrap around that client. So when they come in and they're meeting with our mental health worker. They're meeting with our medical adherence specialist. They're meeting with our housing case manager. They're meeting with all three of those people. And then moving forward, they have a team around them for every aspect that they need. And then it may take a year for them to agree to do something, but we're going to be there that year moving forward. So I just wanted to bring light to all of the programs that we have at USC School of Medicine, Prisma Health, all of the different names that were called, because we couldn't do it without the City of Columbia. We really couldn't do it without the funding we received through our HOPWA program, through our Housing First program. So I just wanted to thank you all, and shout out to my team. I have my whole team over here with me. So
Stand up, team. Please stand up, team.
So we have Tracy. Tracy is our person that holds the office together. We have Erica. She's our housing case manager for all those Housing First clients that we were discussing. Davon, our housing case manager for HOPWA. Justin, our mental health counselor. Adrian, our medical adherence specialist. Brittany, our housing case manager for HOPWA. And Misha, our housing case manager for HOPWA as well. So,
Thank you so much.
yeah. So thank you guys.
And unless there is one more, we have to let.
Person, Dr. Tina.
I'm not a doctor.
Oh, Councilwoman Tina. Good afternoon, everybody. My name is Kamisha Hepard. I'm the Director of Homeless Services. And I just want to say thank you to the board and community development. The work that they do is hard, and it's extremely hard in the current environment that we're working in right now. I know that, they had to make the hard decisions, but they did. And I want to thank the partners in the room that we partner with. This is not something that one agency or one person can do, and we all need to do it together. And I like the way Caroline described the work that they do, because I think individuals, people, organizations, they miss the mark sometimes. The work is really hard, and the work is in that initial intensive case management, but then when you are providing those wraparound services, that aftercare, that's when the real work comes in. And I don't want to take away from what anybody else is doing, but that aftercare is essential. And everyone that stood up today, I heard them speak of aftercare. And so if we can increase that with all agencies, that would be awesome, because that means that I'm going in on the 3rd, you going in on the 13th, that person going in on the 20th. So they have all these hands on them to keep them stabilized in their home. And I know that it's a lot of work. I know that case management aftercare is a lot of work. I know it. Even if your caseload is just 10, it's still a lot of work. It's real people we working with, individuals, and every individual is different. So every aftercare meeting is going to be different. So it requires a lot of the case managers, the outreach individuals that's on the ground, and outreach is essential to this work that we do. And that's why we partner with the agencies to get that done, because we are trying to make sure that individuals that are unsheltered, living under the bridge, living in the cemetery, that they have access to the services. And like Caroline said, and when they're ready, it may take a year, but when they're ready, then we're standing here with them to walk them through the process. So I just want to say thank you to all of the partners in the house, and almost sounding like church. And and again to the City of Columbia Council and Community Development. Thank you so much.
Stay there. Who you are, and it's a team effort. But take just a second so the committee understands what this project that you received funding for will do, because you're building capacity now that we've stepped all the way in to homeless services at the city.
And Ms. Wilson is absolutely right. So the CDBG funding is going to help us expand our kitchen area. And that may sound simple, but expanding the kitchen area gives us the opportunity to provide on-site job training, getting them Save, Surf, Save certified, and just being able to work with them. Okay, picture this. You're homeless for 10 years. And then now you finally decide to come into the shelter. All of those soft skills that you had, all of those rational thoughts that you had, all of those compromises all of those good choices that you would have you no longer have those abilities anymore because now you have been living the 10 years in that, protect myself, survive mode. But now we bring you in, and it would be hard for me to go to a job 10 years down the line and take a directive from somebody. So this opportunity will help us do that, like retrain a person. It is in my opinion, Kamisha is saying this, it is a mental thing, right? So not talking about diagnosis, I'm talking about this is the way I had to train my mind to think while I was surviving on the streets. It's a lot of unpacking has to go there for a person to come back to society and be productive. And the kitchen may sound simple, but it's gonna happen in the kitchen, right? So we're gonna take our time with them, we're gonna train them, we're gonna say, this is how you take constructive criticism. This is how you speak to your supervisor if you don't agree. This is how you place a grievance, right? Because again, if I'm sleeping on the street for 10 years, when I get on somebody's job and you trying to tell me I'm late or I don't look right or I'm not doing this right, I'm gonna go back to what I was used to. So this kitchen is gonna help us do that. And again, I'm gonna say it may sound simple as a kitchen, but a lot of work is gonna be done in there to rebuild our most vulnerable population. And so again, thank you CDBG for the dollars, and we appreciate it.
And we have one more.
To not speak, also, my name is Shonda Richardson. I'm the program manager for TN Development Corporation. To piggyback what everyone else said and to thank the city, my board chair, Talisha, my executive director, Harrison, also work directly with Kamisha, her staff, Felicia and her staff, Dolly, thank you to the CAC. Oak Hill is our transitional property for the city of Columbia. So a lot of the homeless community feed into Oak Hill. The piece that we are missing is the mental health. So it's not that residents can't pay their rent once they get to us, it's the mental health piece that we are missing, that partnership. So we don't like to evict, but a lot of times that's what happens to us, is because they don't have that one-on-one or the case management any longer. So we get to miss that part of it. But these young ladies will come in and they will support us with that piece of it. But besides that, our properties are, or our mission is to provide safe and decent and sanitary apartment communities. And that's what Oak Hill is. So our application was for that. So I appreciate you approving our application for that. And thank you.
Thank you. Any other public comments? Yes, we have one. I feel like Daniel. Daniel, you good? This is great.
Hey, my name is Zach DeMoy. I'm the development director at Mercy, or the Mental Illness Recovery Center. Honestly, I guess maybe this is the benefit of going last. A lot of our collaborative partners throughout the community, they've said a lot of what I would say. We're grateful for all the work, the Citizens Advisory Committee, your work as the council, the Department of Community Development. All of you are so integral to our work and supporting our work in Columbia to provide behavioral health care, to provide permanent supportive housing, to provide street outreach to the most vulnerable in our city. We're really grateful for all of you. It takes a village. I didn't prepare remarks clearly. But that being said, our CDBG project this year is a little different. We've done street outreach in Columbia for, I want to say 13, 14 years, and been in the homeless services space as well as the mental health care space in Columbia for going on 60 years now, which is pretty incredible. Our project this year is targeting specifically women. We've noticed an uptick in the annual reports on homelessness by the South Carolina Interagency Council for Homelessness, SCITCH. There's been an uptick in homelessness for women in Columbia. We want to make sure that not only are we providing, basic street outreach and hygiene kits to these women, we're wanting to make sure that they're getting screened by licensed clinicians and licensed social workers for their mental health care needs. We're wanting to make sure that we're making appropriate referrals, whether that's transitional housing or to our permanent supportive housing services where applicable, to make sure that folks are getting the help that they need and creating pathways forward. We also want to make sure, no, sorry, I was hearing a lot of things. Yeah, I'll just stop. We're really grateful for the support of all of you. We're grateful for the ways that you've supported us for a long time. Thank you for that.
All right, thank you. We appreciate
Thanks so much.
coming.
Thank you.
All right. That being said, and I do want to thank you all for all of your comments. It's one thing to get the reports from staff, the Senate. It is different to hear from the providers, you yourself. So I thank you all for coming. At this point, I am going to ask the committee if they have any objections to deferring committee discussion with Mr. Barry Hall, the interim chief executive officer at Columbia Housing. Are there any objections to that?
No objections.
Okay. That being said, Mr. Hall, we'll have you next time?
Yes.
Is that okay with you?
And we'll
Okay. And so do I have a motion? Well, Madam Clerk, have I forgotten anything?
No, you've done a great job.
Oh, I got a compliment. All right. Do I have a motion to adjourn?
Motion to adjourn.
Second.
And by acclamation, we are adjourning this meeting at 12:36.
Thank you.
Thank you, ma'am.